welcome to another episode of United for a Healthy Stoughton. I'm Stephanie Patton. I'm the prevention coordinator for the town, and I'm really excited. We have a special episode today and some special guests, and so I am going to introduce them, and then I'm going to let them tell you a little bit more about themselves. So to my left, I have Christine, and all the way down on my other left, I have Dan. And Dan, why don't you introduce yourself and tell us a little bit about your background, because Dan's going to really be sharing a lot of important information with us today, and then we'll let Christine tell you who she is as well.
Excellent. Thanks, Stephanie. I'm Dan Foley. I am a person in long-term recovery from substance use as well as my mental health journey. I currently work in the field of substance use recovery as the Assistant Program Director for Connect to Recovery at Riverside Community Care, which is a team of community-based recovery coaches and navigators that just try to partner with individuals on their recovery journey. I'm really passionate about this field because of my experiences in life, and it's a privilege and an honor to be here to share this information with you all, so thank you.
You're welcome. All right, Christine, you want to say who you are?
I'm Christine. I'm a 26-year recovering alcoholic drug addict. I have a degree in human services of substance abuse. I went to school for it. I like to help my community with my previous experience, as well as get to know and learn what's going on today and see how I can help my community.
Awesome. So Dan is going to run through an awesome presentation around overdose, what it looks like, Narcan. He's going to share a lot of valuable information. Christine is representing the community tonight, so she's going to ask all of your burning questions, hopefully, and I'm excited to let Dan really do his thing. So take it away.
Excellent. You
can just
slide deck.
Yeah, are we ready for that first slide? Awesome.
So we're gonna jump into opioid overdose prevention and rescue training tonight. Next slide, please. We already handled our welcome and introductions. And if you're watching this in a group area, these are just some group agreements we like to have. Just take space, make space. That means just be open and interested. Listen to others, make space for differences of opinions and things like that. This is traditionally an interactive training, so be prepared to be called on and share, but
that'll just be Christine for tonight,
yeah,
exactly.
I guess. We just want to be mindful, like what we talk about here, if we're, again, in a group, what happens here stays here, and be very mindful of everyone's lived experience and truths. I tend to share a lot about my past experiences, and we wouldn't want to be disrespectful to anybody, so just always, good rule of thumb, be mindful of other people's experiences and truths. And now we'll look at our agenda and our learning objectives for this training. Next slide, please. So we're going to be talking about what opioids are, how to assess for an opioid overdose, what naloxone is and how it works, overdose response, as well as the administration of naloxone. And then we'll have plenty of time for any questions that come up throughout the training. Next slide. We're gonna, at the end of this, we would like, it'd be great if everyone would have the ability to name 5 risk factors for an opioid overdose, be able to distinguish between someone who's really high versus somebody who is experiencing an overdose, be able to describe how to assess for an opioid overdose, explain how naloxone works to reverse opioid overdoses, and, have the ability to practice overdose response and how to administer naloxone. And anytime we're talking about recovery or substance use, it's important to talk about language, because language matters. It's incredibly powerful, and the ever-changing language in the substance use community, it can be a challenge to keep up on, but it's just human experience language can make a person feel much more welcome in any situation. So when we're talking about somebody that is using drugs or substances, we're talking about a person with a substance use disorder and not an addict, a junkie, a druggie, an abuser. Those all have a very negative connotation to them, whereas a person with a substance use disorder is just describing the person and what they're living with. A person living in recovery sounds and feels a lot better than an ex-addict or a reformed addict. Both of those terms tend to have a viewpoint of something negative, whereas a person living in recovery, the focus is on the positive. A person living with an addiction is a great way to describe someone actively using, as opposed to battling or suffering from an addiction. Again, that negative connotations there with the battling, suffering from an addiction. A person arrested for a drug violation is just stating the facts as opposed to a drug offender. Offender has that sound about it where they are a bad person, they did something wrong, whereas person arrested for drug violation, again, just stating the facts. That's just what happened. When we're talking about someone who might not be interested in seeking their recovery, they're choosing not to at this point, as opposed to non-compliant or bombed out. You know, non-compliant makes it sound as though they're not willing to do something, whereas chooses not to at this point. It's their choice. It's their right to self-determination to choose not to at this point, and that needs to be honored. Medication as a treatment tool is a lot better to say than MAT is a replacement for addiction. And that one comes up a lot in the substance use community, in the recovery community as well. Medication is a valuable tool to many people to recover and stay alive and thrive in life, and that should be honored. And so by viewing it as a tool as opposed to a replacement for addiction is vital. And when we're talking about someone who may have had some recovery time and then return to use, just stating that. They had a return to use. They had a setback. They resumed using. Sounds a lot better than relapsed. If we look at substance use disorder as the disease model that it is, in fact, there's not any other diseases that we refer to with the term relapse. Relapse has a negative connotation about it. So it's important that we frame it just like we would any other disease. Maintaining recovery. Maintained recovery sounds a lot better. It's a focus on the positive. The person has been able to sustain their recovery versus stayed clean. And the reason why stayed clean is something that we're veering away from is because it gives the inference that they were dirty, or other people that are not in recovery are dirty, and that's not the case. They're human beings just like the rest of us. And then if we're talking about drug screens, they tested positive on the drug screen for whatever the substance is a lot more positive sounding than they were dirty for or they failed their drug screen. It's not a pass or fail thing. They tested positive for a certain substance, and it's just about capturing the information as opposed to putting an opinion on that information. So now we're going to talk about what are opioids. And opioids fall into three basic classifications. We have natural opioids, which are chemical compounds that are extracted or refined from natural plant matter, such as the opium poppy. Common examples of those would be opium, morphine, or codeine. Then we have the semi-synthetic opioids, which are synthesized from natural opioids. Examples of those: heroin, hydrocodone, hydromorphone, oxycodone, oxymorphone, and buprenorphine. Buprenorphine, for those who don't know, is also the actual name for Suboxone, which is the trade name. And another one that falls into that category that's not on the list, but we hear a lot about, is OxyContin. And then we have the fully synthetic opioids. And those are synthesized to have opiate-like effects, but they have nothing naturally occurring about them, such as fentanyl, methadone, and tramadol. And so when we talk about fentanyl, I believe most of us have probably heard of fentanyl at this point, but there's a lot of misinformation out there around fentanyl. And, you know, some of the facts are fentanyl is 50 times stronger than heroin and 100 times more powerful than morphine. It binds faster than any other opioid that we know of right now. And it is frequently administered in medical settings to alleviate extreme pain. And then some of the misinformation that's out there would be simply touching fentanyl can lead to overdose and death. The way that fentanyl is created chemically, it is not something that we can ingest transdermally, meaning through the skin. It needs to be chemically altered for it to be transdermally administered into our system. And there are fentanyl patches that are used medicinally that have that chemical alteration. However, to come in contact with your skin to a powdered form of fentanyl, you do not stand a risk for any type of opioid overdose or death or anything like that. That is a myth that has been debunked. Being in the same room as fentanyl poses a huge risk for exposure. Again, we've seen news stories, we've seen all sorts of things out there about this, and just being in the same room as some fentanyl is not going to pose a health risk to someone. It would have to be a very extreme situation where there were clouds of fentanyl dust in the air for us to actually be at risk for it. And then this one is interesting, where many marijuana users have been reported to overdose on fentanyl. And there's been many reports of this, marijuana that has been laced with fentanyl, and some teenagers smoke it and they overdose. And a lot of research has been done on that, and it turns out that the combustion rate for fentanyl, where it can be ingested into our system through our lungs, is different than that of marijuana. So although they'll burn together, it won't be at the right temperature for the fentanyl to actually have that psychoactive effect and have that same depressionary effect on our respiratory system. So that is not a concern. And what they found is, more often than not, in those situations where a group of kids were smoking some marijuana and some of them might have overdosed, those kids weren't forthcoming with what else they had ingested. And it turns out that in most of those scenarios, they had ingested some pills that contained fentanyl, but they didn't want to report that due to fear of getting in trouble with mom, dad, or the authorities.
Wow. I just learned a lot of things just in that one slide.
Do you all have any questions too? Please always feel free to interrupt me. I tend to just get going.
No, it's good.
Okay. Did you,
Christine, you want to ask anything?
So far, I'm all good.
Okay.
Excellent. And here are just some statistics around opioid-related overdose deaths with specific drugs present. You know, you can take this information and do with it what you please, but if we look at the time frame on it, we can see that, you know, we saw an escalation in fentanyl around 2014 into 2015. It really spikes, and then there's an intersection where the heroin overdoses dropped drastically around the midpoint of 2015, and that's when fentanyl really came on the scene. And you know that we've seen some ebbs and flows in terms of the overdose deaths associated with fentanyl or opioids in general, but you know, right now we're on an upward trend, which is why a training like this is so vitally important. And then we also can see that there's a lot of other substances on board at times during these overdoses. So polysubstance use, meaning using multiple substances, can be a contributing factor to opioid overdose, as well as the death rates involved in those overdoses. Next slide, please. And so now we're going to jump into talking about the risk factors for overdose and recognizing an overdose. So I'm going to turn to my lovely participants here, and I want to ask, what do you think are some risk factors for an overdose?
I didn't know we were going to have to do audience participation. So I know some risk factors for overdose are somebody who is just coming out of treatment, or somebody who is coming out of being incarcerated, often because their tolerance has changed during that time. And if they were to use an opiate after that in the same amount that they might have been using it prior to that block of time when they weren't using, that it can have a different kind of an impact.
That's a great one. And yeah, a small period of abstinence from opioids and the tolerance drops dramatically. So after a period of incarceration or getting out of treatment, or even if they had just sustained recovery for a period of time, short or long, they don't even have to use the same amount. They can use less, and they can experience an overdose. So great job,
So
Stephanie.
times that somebody might be, those are times somebody might be at higher risk, and we would want to have Narcan around, potentially, right?
Have Narcan around, have conversations with them around the fact that they are more susceptible to an overdose, and talk to them about testing their product. You know, if we're talking about incarceration, someone might not have been on the street when fentanyl became prevalent.
Right.
So they might not be fully aware of the risks involved, or understand that more often than not they're going to be purchasing fentanyl, not heroin now. Or if they're buying pills, to test those pills, because a lot of the pills are fake and pressed fentanyl. So yeah, it's a very important risk factor you just identified. Do you have any?
I think it's when you're around other people and you're trying to show off. It's, okay, you can do that, I'm going to outdo you. And it's that competition of the next addict, of you can get that high, I can get even higher. I witnessed a lot of that, of competition of, I'm a better addict than you because I can handle more. So I've been around that. It's like you said earlier, of not being aware of what your product is. It's drug dealers are not your best friends. So you really don't know what they're giving you or what they're lacing. You know, you could simply think you're getting just a joint. In reality, that marijuana joint could be laced with multiple other things, and you're not even aware of it. So I think overdose factors is you don't let the drug hit your body when you go for another supply. So you're just putting more, trying to get that high without your body reacting first.
Yeah, and that's a very valid point. And if you're changing your route of administration or trying to up the amount that you're taking, that would be a very big contributing factor.
I think Christine also, and you had brought up in the answer that you gave, was fentanyl is a risk factor, right? So the fact that, like, when I looked at that chart, that was sort of interesting to see sort of that heroin's involvement in overdoses has gone down and fentanyl's gone up, and it made me also think about just the potency. And like around that same time, we started seeing more Narcan, and our public safety folks are carrying it. But if the fentanyl is faster and stronger, that you need more Narcan to maybe sooner or more of it in order to counteract that. And so I would imagine that the fentanyl in the drug supply would increase somebody's risk too.
Yeah, and one of the risk factors we'll talk about in a minute is your source, your supply, changing where you're getting it from, or your supplier might be changing where they're getting it from unbeknownst to you. So that source can change even though you're going to the same person, and that can be a driving factor towards overdose. Because potency,
right?
You know, this isn't pharmaceutical grade stuff we're talking about. It's mixed out on the street, and so even within the same bag, the consistency can differ if it wasn't mixed properly.
Right.
So with the cutting agents and things like that. Can we bring the slides back up, please?
I had another answer.
Oh, please go right ahead. I don't mean to cut you off.
No. I think sort of almost the opposite of what Christine was talking about, which is using alone as a risk factor, right?
Yes, using alone is a huge risk factor for death, overdose death. You cannot Narcan yourself.
Right.
You cannot administer Naloxone to yourself.
So there might be nobody around to know that a person is in trouble and needs help if the person was using by themselves.
Absolutely, and that one is incredibly important, and that's why we have different ways. So even if somebody doesn't have a physical person with them, there are numbers they can call, so someone can be on the phone with them. And if they experience an emergency, they can contact authorities for them. But never using alone is important, and when we're talking about the fatalities involved in the overdoses, absolutely.
Yep.
So as we talked about, a period of abstinence, including a period of sobriety, a stay in treatment, hospitalization or incarceration, moving to a new neighborhood in a city or town can have a wildly different product on the street, and so not knowing how strong that is can be a big overdose risk factor. And same thing with the new dealer or source. But then when we mix opioids with other depressants like benzos or benzodiazepines or alcohol, those also slow down our respiratory system, which can increase our likelihood for an overdose. Having a new route of administration, and what that means is if somebody is using nasally, they're snorting it, and then they start to inject it, IV use, they are at a higher risk for overdose. It's going to affect their body differently. Then just having poor physical health. You know, these depressants that we're talking about, opioids, alcohol, benzodiazepines, they slow down our respiratory system. So if we are experiencing poorer physical health, our respiratory system isn't going to be able to handle those things as well. And then this one, a lot of people aren't aware of, but if you've experienced a previous overdose, you are more susceptible to experiencing more overdoses. And when I learned that, it kind of blew my mind, but I think of other things in life, and I come back to boxing. And if we look at a heavyweight boxer that went undefeated for their whole career, and then they get knocked out, what we tend to see happen is their career ends after a few more fights, and they tend to get knocked out more often. And I think the same thing's true with overdose. Our body, our system takes a hit, and it kind of opens up that doorway, and so now we're more susceptible for it to happen again. And if somebody experiences an overdose today, for example, and receives Narcan or Naloxone, those effects wear off within an hour and a half, and there's still opioids in the system. They can actually go back into overdose without ingesting any other substances because they just had an overdose and there's still opioids in their system. So that's why it's important when we're talking about administering Naloxone and Narcan to make sure there's medical attention if the person's willing to seek it, so they can be monitored to make sure that they stay safe. And then, as you mentioned, Stephanie, using by yourself greatly increases your risk for a fatal overdose. So, like we talked about before, just making sure that you don't use alone. That's there's no coming back from that.
You know what I'm realizing, Dan, as we're doing this, and maybe to also, just for context for people, as we're talking and we're presenting this information in a way that is important, really important, but also is sort of harm reduction. So I think for people watching at home who have a variety of life experiences, right, ranging from like maybe I don't even really know what opiates are, to folks who have somebody in their life who is actively involved in heroin misuse or opiate use or some, like sort of we have this whole gamut of folks who might be watching this, and to sort of that really what we're talking about, and we're really trying to provide information for folks who maybe are close to individuals who maybe really need this information. And you never know when you might be the person who is close to an individual who might need help. And so I think I want to sort of caveat that, because I'm realizing, I'm like, as I'm listening to you talk, that for some people who haven't had these conversations before, they might be like, whoa, like this, what?
Yeah.
Right? Like, and how important this is, and how important it is to reduce the stigma. And I think, and that's why I really appreciated you starting with language and this idea of like people first. Like, we're all people. People have all kinds of things going on in their lives. And so I think, I just, like, as you were speaking, I was just thinking about like, oh, I wonder, because we're in a studio and we don't have, we're the studio audience today, that, you know, just thinking about folks at home, and people are going to be coming to this hopefully from all different types of experiences, and learning some things that might be immediately relevant or might not at this moment be something that like they need but could need at some point in their lives, or want to know more or help people. And so, you know,
this could also help open a conversation piece,
right,
with family members that, okay, you may not have experience, but you see family that does. Okay, I just learned this piece on Narcan.
Yep.
Or it could be your introduction of, could you explain to me why you like opiates, why you use. Like, it could just open the door to let families start talking about it and being honest with each other.
Right.
And there's so many of us that hide our addiction and our use out of embarrassment, out of fear, out of shame, guilt, being judged. So it could be very difficult to have an honest conversation. Now that we're getting facts out, we're opening the doors for people that may not know what it's like to try drugs, to become addicted, to be able to have a conversation as a family and say, let's talk about this. Let's educate each other.
Right, right. Well, and I think the bottom line, and also why this is so important, is in the absence of those conversations, we can't help people. So, you know, if there's somebody in your family or in your immediate sphere who is using opiates and you are unaware of it, then it might remove that opportunity if that person was in trouble or in a situation where they were experiencing an overdose. People might have no idea that that's what's going on, or have on the radar, like, I really want to make sure I have the tools, which we're going to talk about, some of those tools to recognize this and to act, right? And so I think being able to think about, like you were saying, having those conversations is also an important piece to all of this too.
Yeah, I do believe talking about it is one of the biggest tools we have in fighting the stigma. And as you pointed out, that stigma can be a huge barrier to someone recovering because of the guilt, shame, remorse, all of those very heavy, strong feelings that come along with use. If we're not talking about it, we can't work through those. Right. And if our family, our friends, our loved ones, our community isn't willing to talk about it, we get pushed aside.
Right.
And when I hide in the corner and I'm actively using, bad things happen, is what I've learned. But for me to be open and honest about things, it helps me to move forward. And I know it helps a lot of other people to move forward. And in terms of harm reduction, I'm so glad you brought that up. That's a huge part of my recovery. Today I practice abstinence in my recovery, but I tried everything in my power through my years of active use. Harm reduction kept me alive. It kept me from suffering from vicious infections that could have ended my life or taken my limbs. You know, harm reduction is a very important conversation to have, and it's a lot of people can be kind of pushed away from it. Oh, that's, you know, it's justifying their use or whatever, but no, it's about self-determination and people staying alive. You can't recover if you're not alive.
Right, right.
You know, and any person that's in recovery, harm reduction is a part of their story. Because we tried to moderate, we tried to use in safety, we tried all of these things till we found what worked for us, whatever that path in recovery is. For, like I said, for me it's abstinence, for some people it's medically assisted treatment, using medications. There's so many paths to recovery, but we gotta find what works for us. And the way we can do that is through harm reduction, by staying alive.
Right, right. And I think we had a lot of those conversations years ago when we were Oasis was working with the police department and the town to help our police department carry Narcan because they really wanted to do that, and that was a really important part of, I think, the messaging when we were talking about this in the community is people can't find recovery if they have a fatal overdose, and so we all have a responsibility to help each other in in anybody's, whatever anybody is going through, and that is a tool that exists. So I want to let you keep going, guys. I know you have a lot of content. we could have this conversation for the next 45 minutes, but that's not what we're supposed to be doing.
Excellent. So we're going to talk about trying to recognize an overdose versus someone who's really high. When someone's really high, their muscles become really relaxed. Their speech can slow down and get slurred. A lot of times it sounds almost like they might have marbles in their mouth when they're talking. They can look extremely sleepy. They could actively be nodding off even mid-conversation. But they will respond to a stimuli like yelling, pinching their skin, or a sternal rub, which we'll talk about a little later. But a physical pain sensation, they'll react to that.
Dan, can you say a little bit more about what nodding is for people who maybe are unfamiliar with that term? Like, can you just explain it for a second?
I mean, the best way I could use to describe it would be to be dozing off. So if I was sitting here and my head started dipping and my eyes started closing, that I would be considered to be nodding off.
Okay, perfect.
Thank you for asking.
Yeah.
Not everyone's aware of these
right.
terms.
I am guilty of often using acronyms, so I am, and people have to remind me, so I will, if there are words, I'm going to try to jump in and remind all of us.
Thank you. And when we see an overdose, it's different. There's this shallow snoring, gurgling, labored breathing. It's called a death rattle, and it's a very difficult sound to describe, but if you ever heard it, you would know that you were hearing it. It's just this gurgling that's coming almost from the gut more so than the lungs. There's very infrequent or no breathing whatsoever, whereas when someone's really high, you'll see their chest rising and falling, whereas if somebody's in an overdose, those rises, those falls, their breaths are not happening at the rate they should be for someone to stay alive. If they're nodding, it's a heavy nod. It's not like they won't respond to any stimulation. You can yell, you can pinch them, and they're not going to respond if they're actively overdosing. If you were to check their pulse, it'll be very weak, very slow. And then there's the wooden chest syndrome that you might see, which is almost like a tripoding position, where it's like their body's trying to breathe, but it just can't do it. And it's very recognizable. If you ever encounter it, it's almost unsettling to see, but you quickly can identify there is a medical thing going on here that needs to be addressed. And when we talk about other ways to identify it, if somebody with white or fair skin is experiencing an overdose, it'll be noticeable in their skin, and their eyelids and their nail beds and their lips will all turn a bluish color. Someone with black or brown skin, their skin almost turns a grayish hue, and their lips will turn gray or purple, and the nail beds will turn a vivid white color. And if somebody is really high, it's good to stimulate them, observe, stay with them if you can, because they might fall into an overdose. If somebody's overdosing, we'll talk more about what that looks like a little later on, but we want to get them Naloxone, Narcan, and make sure they're breathing, performing rescue breaths if necessary. And so we've said Naloxone, I couldn't even tell you how many times already, so what is Naloxone?
People are dying every day from opioid overdose. Parents and children, friends and neighbors. But Naloxone can help. Naloxone is a safe and effective rescue medication that reverses the effects of opioids and saves lives. To understand how naloxone can stop and reverse the effects of an opioid overdose, it's helpful to see how opioids work in the body. Opioids are agonists. This means they bind to and activate specific receptors in the body, including the brain, brainstem, and spinal cord. When these receptors are activated, people experience the effects produced by opioids, such as pain relief, euphoria, calmness, relaxation, and slowed breathing. Taking too many opioids causes so many receptors to fill and activate that breathing may become dangerously slow and even stop. This is how an opioid overdose happens, and this is where naloxone can help. Naloxone has a strong affinity to opioid receptors, more so than most prescription opioids and heroin. But unlike opioids, naloxone is an antagonist. This means it attaches to opioid receptors without activating them. So when naloxone is administered during an overdose, it knocks the opioids responsible out of the way and allows breathing to normalize. Naloxone can be administered through an injection or a nasal spray. It usually starts working within a few minutes and lasts from 30 to 90 minutes. While one dose of naloxone can reverse an overdose, sometimes multiple doses are needed, especially in cases involving extremely potent opioids like fentanyl, or opioids that stay in the body longer than naloxone. Naloxone is very safe in single or multiple doses. It may produce withdrawal symptoms in people with opioid dependence, but it has no abuse potential and cannot cause an overdose. It's important to remember that naloxone is opioid-specific. It has no effect on an overdose caused solely by non-opioid substances like benzodiazepines or alcohol. At the same time, people shouldn't be afraid to use naloxone when the cause of an overdose is unknown. If opioids were not involved in an overdose, it won't cause any harm. If opioids were involved, naloxone can save a life.
So what is naloxone? It's also called Narcan. You've heard me kind of use those names interchange throughout this. Narcan is the most common name for it. You can see it on the slide.
It would be like if we said Tylenol instead of acetaminophen or
exactly.
Advil.
Naloxone is just the generic name of the medication, whereas Narcan is the name brand that we're all most familiar with.
Yep.
It's a medication that can reverse an opioid overdose. It is specific to opioids, not any other substances. It typically it takes effect within 3 to 5 minutes of administration, and it lasts between 30 and 90 minutes. And what it does is it blocks the opioids from the brain receptors. So if there are opioids latched onto the receptors in the brain that we learned about in that video, it pushes them off, and it also makes it so other opioids can't latch onto those receptors. There are no known side effects to naloxone Narcan. There is no potential for abuse. There are no psychoactive effects for it, so there's no compulsion to use it or to misuse it, I suppose. And it cannot cause harm if someone is not using opioids. If I were to take some Narcan right now, I wouldn't have any ill effects. It would be like taking some Dristan and that's it. And we just always want to be mindful with it. You know, I carry naloxone Narcan with me just about everywhere I go, but I have to be conscientious of where I keep it. before I learned this fun fact, I kept it in the glove box of my car. And what I learned through trainings like this is that can greatly reduce the effects that it can have.
It can get too hot in there.
Yeah, it is temperature sensitive, so now I carry it in my laptop bag, which comes with me. I never leave that in my car, but it tends to be with me most times.
Now, we do have a community question in regards to this.
Good.
How many doses? Is it a guaranteed 1 dose? Or are there people that overdose that might need a third dose immediately following?
It's a great question, and it is not guaranteed one time. And so, 3 to 5 minutes when we're administering it, we want to wait 3 minutes before we give a second dose. Hopefully, we see the person coming to after that first dose. If we don't, we administer a second dose and kind of rinse and repeat another 3 to 5 minutes. There's no harm if you administer it before that 3 minutes, the second or third dose. It just won't be effective. It takes a little time for it to absorb into the nasal cavity, and so we just want to, instead of wasting it, make sure we wait that time.
The appropriate time.
There were many reports of people receiving a dozen doses when fentanyl was really coming on the scene. And anecdotally, talking to first responders that had administered them, they acknowledged that they would just kind of one after another because they wanted the person to live.
Right.
There was no harmful side effects to that, but there was medication that arguably was wasted.
And I had a conversation with someone recently. It's different to actually give Narcan yourself than what you see on TV. The TV shows and how it's represented is a whole lot different than real time. So just because you're a Chicago PD, Chicago MD fan, or any of those shows and see it performed, does not mean that that's the truth, the reality, and how it should be played out in real life.
Yes, exactly.
Yep.
I think, there's a lot of discrepancies between what we see on TV in terms of medical treatment and things than what is in reality. But that is a very valid point, because those types of shows might be the only place people have seen these things. So,
And we all think we're an expert after 3 episodes of Grey's Anatomy.
Right, that's right. You can perform open heart surgery because you've seen Grey's Anatomy 3 times. Yep. I think 2 things I was just thinking about as we were talking. So one, in terms of like the multiple doses of Narcan, hopefully, somebody, if they needed to provide Narcan to someone that in that same time period are calling 911 and are bringing additional medical support on scene, that's the ideal scenario, right? Is like when we provide Narcan to someone, we do want to involve first responders, because they'll have more Narcan with them, which a bystander might only have the 1 dose, and we don't know, like you were saying, if it's enough. And then also the paramedics have the ability to administer Narcan intravenously. So I know, like for some of us, Narcan feels really new, but the truth is it's been on board ambulances for a really long time. They just, the nasal Narcan, the ability for people in the community to carry it is newer. But the fire department, like our fire department, who are also our ambulance service here in Stoughton, have been using Narcan for a really long time. So it's kind of, like for them, this wasn't new when we started talking about bystanders and the police department carrying, which now isn't new either. It's been a long time, luckily. But so there's that piece. And then the other thing that I remember from the time when we were training all the police officers now years ago, and I wish I could say the year, but I don't. I'm going to get it wrong. So it's been a long time. We worked with an emergency room doctor, Dr. Dan Muse, and I want to say his name because he was a real champion for this work all across the state, and he happens to be the medical director also for our fire department, incredible human. And he used to talk in those trainings to the police officers, and he would say you literally could bathe in Narcan and nothing bad would happen to you, unless if you were overdosing, it would reverse the overdose. But that, like, this really can't hurt anybody. It is not like giving somebody a dose of epinephrine or some other medications that also are used in emergency situations, that basically Narcan is like saline. It's just inert unless somebody had opioids in their system, and then it would reverse the overdose, which maybe won't be pleasant for somebody. but is not dangerous. And so I think that also provides a lot for folks who are like, I don't know, like I'm worried if I do this, like what if it like sends the person into some other dangerous medical place, and the truth is all it can do is reverse an overdose. And so like you were saying, like any of us could use it right now and it would be like saline.
Exactly.
It would be, there'd be no effect. Like we'd be waiting for something dramatic to happen, and it's not. It's gonna happen.
Exactly.
Yeah.
Thank you. And just real quick, every Narcan has an expiration date on it, and even if it's expired, what they found is it's still effective. It loses its effectiveness. So if all you have is expired naloxone and Narcan, use it. It's better than not using it. Just wanted to point that out because every package does have an expiration date on the back. It's good to check that and keep up with it, but if you don't and somebody's in an overdose, use what you have. It's going to do more good than it could possibly harm. And this is a list of some locations where you can get naloxone in the state of Massachusetts. If somebody has Mass Health, there is a standing order at every pharmacy in the state, and they can access Narcan naloxone for no copay with their Mass Health at those pharmacies. It's also been approved for over-the-counter use in Massachusetts. So you can just outright purchase it at pharmacies, or I believe Walmart now has it. It's a little pricey in my opinion there, I think to the tune of close to $40. But at these locations on this slide, you can access it for free. And there is the Massachusetts Substance Use Helpline number up there, which is 1-800-327-5050. If you are in need of, or you want to get your hands on some Narcan, you don't have this slide handy, you can always call them. They're answer the phone 24 hours a day, and they can direct you to any one of these sites.
And we have the helpline information on the Oasis website, which is just stoughtonoasis.org. And I actually will make sure I get that slide from you and put the Narcan distribution sites on our website as well.
Excellent.
Yeah.
And this is some information about the Community Naloxone Purchasing Program. If anybody watching this is involved in a program in the substance use field that is BSAS licensed or funded, they can access naloxone through this program at little to no cost to the program to help distribute it as well.
Ooh, the answers are there. That makes
I
this
know,
quiz
this
easy.
took the pressure off of you guys.
I didn't even notice that.
So, we can run through these questions though, and naloxone is addictive, commonly abused even after an overdose. Clearly, I think we all know that one is false after the wonderful education we just received.
That's right.
on
And if we
this.
didn't know, the answer is on the slide.
This one's an interesting one though, and this one kind of comes back to what you were saying about the TV shows where naloxone makes people violent. And that's, something that I have heard through, people I've talked to. And as a person who has experienced what it's like to have what's referred to as dope sickness. When you're coming off of opiates, your body reacts and you go into withdrawal. It's commonly referred to as dope sickness. And I'm trying to figure out a good way to frame it. Like when you're experiencing opiate withdrawal, it's like the worst flu you ever had times, what, like 100, maybe 1,000. A lot of times, for me, it felt like the bones within my body wanted to break themselves. I was in a lot of physical pain, as well as physical ailments going on due to it. And when Narcan naloxone is administered to somebody who is dependent on opiates, that's what they feel like. So if you think about the worst flu you ever had, how violent could you be in that moment of time? A lot of times when this situation occurs, when someone's coming to, there might be a field of police officers or first responders around them, and this person might have had some adverse experiences with law enforcement in the past, so they might react like scared.
Might be a little startled at first, but they're not going to come up starting to swing or anything like that.
Exactly, and so I'm glad that that's in this presentation, because that's a concern for a lot of people, because they've heard those things, and I would not want anyone to have hesitation in administering a life-saving medication out of fear of someone becoming physically combative, because it's not a very likely thing at all. I think if we actually look at the rates of assaults during the administration of Narcan, they're almost non-existent. And if you dive into the ones that do exist, there's extenuating circumstances. There was something else going on. And then, you know, we talked about this, naloxone could do serious harm if it's given to a person who's not high. That one is definitely false. It's like, as you said, it's like saline. It's inert unless there is opiates involved.
And actually, I think the flip side of that is important. Maybe flip side is the wrong thing, but if somebody was overdosing or experiencing something from a drug that was not an opiate, it also means that the Narcan won't do anything. So, and I think a lot of times, because it's inert, it's also going to be one of the first things, like first responder probably, it's like a great tool. Like, okay, if we arrive on a scene, or if you're a bystander and you arrive somewhere and you just aren't sure, it's not going to hurt somebody to do that. But if it's not opiates, you're still going to be there. It's a medical emergency, even if it is opiates, right? Even if you successfully can reverse the overdose with your Narcan. But I think that's another reason why we always want to call 911 immediately. Like, we don't want to wait, because we really don't know what's going on, or we don't know. Sometimes you were talking about polydrug use. Sometimes there's other stuff going on. So like, we might be able to reverse the opiate part, and there could be some other things that are happening in this person's body that are dangerous for them, right?
Absolutely.
So which leads to a great question. If I approach someone overdosing, and I'm a stranger, or if I see someone, what would you say would be my steps to assist that person in the best possible way?
Oh, you might be jumping ahead.
That is a great question, and we will answer that in just a few minutes.
Okay.
All right.
I appreciate your patience. And then this number 4, naloxone does not flush opioids out of the brain. If you notice, that answer is true, and we talked about that a little bit, where it pushes the opioids off the receptors and blocks the receptors, but those opioids are still there floating around the brain.
Right.
So when the naloxone wears off, those opioids can go right back onto those receptors. So when somebody, if you administer Narcan, and if somebody's expressing how horrible they feel, that's important to share with them. This is going to pass. 30 to 90 minutes later, you're going to feel a lot better.
Right.
You know, and just by sharing that, because a lot of people don't know that, it might change someone's decision making to where they might be less likely to go use to get rid of that feeling. And as we talked about earlier, they just experienced an overdose, very likely to overdose again. So to prolong that time of them picking up again, using again, could be very helpful in saving their life.
Right. Well, and you had said earlier, it's also possible that if there was enough opiates left in their brain, they could go back into an overdose when the Narcan wears off. So another good reason to think medical attention important, right?
Absolutely. Absolutely. And then we talked about this one as well. Obviously, more than one dose may be necessary in some overdose situations. You raised that question, and yep, we know that to be true. And when you get naloxone Narcan, it comes in a 2-pack, so you should always have 2 doses with you if you carry it. So now we're going to talk about overdose response and the administration of naloxone.
So you're going to get your question answered.
Yes,
Yay.
there you go.
Oh, look at this.
So we're going to lay out this scenario. Jason has an appointment with you for 9 a.m. this morning to talk about possible work opportunities. He arrives an hour late for the appointment and doesn't seem himself. You ask if he's okay, and he says he's fine, that he just really needs to use the bathroom. You walk him to the restroom, and per your bathroom policy, you start the timer for 5 minutes. The timer goes off and Jason is still inside. You knock loudly and call out his name, but there's no response. After another loud knock and calling his name, you announce that you're coming inside. You push open the door to find Jason unconscious on the floor and his lips and fingertips have started turning blue. How would you respond? Do you guys want to try to put those steps in the corner in order?
Ah. The screen is far away, so part of it is like we're both trying to like read the screen.
Yeah.
I would definitely start to assess what was going on. Check his arms for needles. Check for baggies around. Maybe if he snorted. I would probably lay him flat. Like depending on what position I found, if like he's hovered on the toilet, I'd probably try to lay him down. And pinch him to see if I can wake him up, yell.
Yeah, and you know, in these moments, this is an interesting scenario that's laid out here. This is more designed for people working in the substance use field. Like clearly there's a policy in place about following someone in the bathroom.
A bathroom policy, yeah.
You know,
Yep.
so if we could jump to the next slide, we'll go right into putting those steps in order. So, next slide, please. What we really want to do is recognize the overdose. We talked about how to recognize them earlier, so in that scenario, we'll want to take a look at Jason and assess for the overdose. Once we determine it's an overdose, call 911. First thing, ideally, if there's more than one person there, you call 911 while I'm administering the naloxone. If there's a group of people, it's always important to single one person out and task them with calling 911. If we just say someone call 911, the fear that I always have is everyone will assume someone else is doing it and it won't get done. So by singling out an individual, you call 911, make sure that call's placed. Then we want to administer the naloxone right away if possible. After that, we kind of fall into our CPR trainings if we have CPR trainings, but essentially making sure someone's breathing. You know, that's the most important piece. Giving them rescue breaths if we need to, and then if there's no pulse, the CPR compressions as well. And then stay with that person until help arrives. We called 911. We want to make sure we stay with them until they get there. We can pass off pertinent information, when the last time naloxone was administered, things to that nature. And then if they do start breathing, get them into the rescue position, which we can see on the slide up there is just kind of like cuddled up on their side, nice and comfortable, but that way if there's less of a chance of their airway being obstructed if they were to have spit or throw up or anything like that. It has a safe pathology to get out. So if someone is unresponsive, we talked about the sternal rub earlier, and all that is taking your knuckles and grinding them into the sternum of their chest. It's painful. If you ever see someone who's received a sternal rub, there's a rash there. There's like, it almost like a really bad sunburn from the location. And it's physical pain. Nobody likes to cause someone else physical pain, but we're trying to determine whether or not they need more attention medically.
And so, you know, if they don't respond to that, they are really unconscious, because any other person, because it really is so uncomfortable, is going to react.
Exactly. Assess their skin color like we talked about earlier. And once we determine it's some sort of medical emergency, get someone to call 911. And that's when, if we have more than one person, we can assign tasks, get everybody into their role so we can make sure all of these things are getting addressed. Next slide, please. And then the Good Samaritan law is always good to talk about when we're talking about administration of naloxone, Narcan. And these were put into place to protect individuals that call 911. There was a period of time in Massachusetts where people were really reluctant to call 911 in these situations because they had the fear that they would face repercussions through law enforcement. So the Good Samaritan law came into place, and so it protects whoever called 911 so that they won't face any legal repercussions aside from the 3 W's, which is weights, warrants, and
There it is. Weapons.
weapons. Thank you. And so if somebody has a large quantity of substances, when the first responders arrive, they're not going to be protected by the Good Samaritan law. And the warrants, they can't change that. That's something that's just kind of with the person and if they have weapons on them. But other than that, if there's no reason not to call.
Right.
You can call 911 and stay with that person till they arrive, and if you have a small amount of substances or something like that, you don't have to worry about getting arrested if you're the person that called. That's who it protects, is the caller.
Now, does that law protect if I give a stranger Narcan, because I've done all the assessment, I've fully determined that the person I see, a stranger, is overdosing. Am I protected from saving that person's life because they cannot answer my question of, can I give you this medication? May I save your life? They're unable to answer me. So are there any fears if I give a stranger this life-saving medication, can that person come after me legally and say, I didn't want the medication, I wanted to die, I was trying to commit suicide, I knew what I was doing. You know, is there any reason why I should fear helping a stranger?
It's a great question, and thank you for asking it. And the answer is very simple. No, there is no concern for any legal recourse for administering this medication. You are perfectly okay to administer it. If somebody is experiencing a medical emergency, you view it as an overdose, you've assessed it, it seems to be an overdose. We've already talked, if it's another type of medical emergency, it's not going to cause them any harm. And if it is an overdose, yeah, they can't come back at you, they can't get a lawyer and sue you because you squashed their right to self-determination and it was an intentional thing they were doing or anything like that. So great question. There is no ramifications for administering this medication.
I just want to make sure that the people in the community know.
Exactly.
Because they might be hesitant to help. So, like, I'm a helper bee. I like to help people. That's just who I am. And my daughter is the same way. My daughter is, oh, you're sad, let me try to make you laugh.
Right.
So I want the community to know that it's okay to be a helper bee. And it's definitely 100% okay to save someone's life if you have the ability.
Yep. And definitely get on your cell phone and
Call 911.
get some help for the situation. Yeah. And I think, and it's really, you know, I mean, I can speak here in Stoughton. I've been working with the police department for a long, long time around this issue. And, you know, it really is treated as a medical emergency. And I think even if you could give more information to the person who, when you call 911, who answers the phone and say, in fact, that it's an overdose, it does help whoever responds in that situation to really know what they're walking into. Sometimes you don't know, like, you know, a person is unconscious, I don't know why. Here's what I do know. But I think, I know there was a time where folks were hesitant to sort of name that on the phone. You know, the more information you can provide a first responder, the better equipped they are to respond. And typically, in Stoughton, what tends to happen is the police often have a faster response time, not by a lot, but by a little bit, than the fire department, because the police are on the road all the time. And so it's likely that they might be closer to your location. And so when that 911 call comes in, and that was why it was so important for us here to make sure all of those officers were equipped with Narcan, because I think back before that happened, what would often happen is a police officer would arrive on the scene and they could do rescue breathing, but that was sort of the only tool in their belt. And they were like, I know what I'm looking at, and this thing is out there to help people and we don't have it. And so that was why all those years ago, in the year that now I forget. We all worked really hard as a community to say, like, let's make sure we're giving everybody all the tools so that they can start this process. Maybe a bystander starts this process, or a family member has Narcan, they can turn it over to whoever, whether it's the folks in blue or the people in red who get there next, and they all are sort of working together as a team to help somebody and save a life. And so, the more of us that have this tool is better, right? Because it's more likely somebody nearby is going to have that ability to help somebody.
Yeah, and in these situations, the sooner we can get this medication administered, the more likely it is to be effective. So the police are responding
matter.
first.
Yeah.
Those minutes matter.
Right.
If I'm there, I matter. I
Right.
can get it in that much quicker, but then stay there to pass that info along, because maybe police arrive in a minute and a half.
Right.
Oh, I just gave it to them a minute ago. We know to wait a couple minutes and focus on the breathing.
Right.
And so, the more information we can pass on to the first responders, the better benefit it is going to be to the person that we're trying to help
Right.
here.
Right.
Absolutely.
Right. All right.
So when we're talking about responding to these overdoses, at a bare minimum, through COVID, a lot of people very hesitant to perform rescue breaths on other
Right.
people, and some people just don't have that training. Call 911, and if you have naloxone, administer it, and just stay with the person till they arrive. And then best practices: call 911, administer the Narcan, wear the proper protective equipment to keep yourself safe. If you have like a mouth breather to help you administer safely those rescue breaths. If you just happen to travel with a bag valve mask, that's great. Not a high likelihood there, obviously.
Right. Yeah.
But some people might. And then chest compressions. We're just going to follow our CPR training if we are trained in CPR. But if you get 911 on the phone and they stay on the line, they are really good at talking people through that who have not received the training. And if you find yourself in that situation, that training might fall to the wayside when adrenaline takes over. So to have somebody on the phone reminding you of the process could be very helpful as well. And then if we have more than one person on scene during an overdose, it's good to have these roles identified. Role number one, get someone to call 911, report that the breathing's slowed or stopped, they're unresponsive. If we're confident it's an overdose in a town like Stoughton, where we know there's no stigma around responding to these calls, share that information. That way they know what they're walking into. Then if we got more people there, role two can get the naloxone, administer it, begin breathing for 3 minutes, which is one big breath every 5 seconds, with someone keeping track of time if possible, because again, when that adrenaline's soaring, time can morph. So if you can get someone on a clock keeping track of that, it can be very helpful. And then switch off that rescue breathing can prevent fatigue. If you've ever administered CPR, you know it's tiresome. It takes it out of you. If after 3 minutes of rescue breathing the person is still unresponsive, administer another dose of Narcan. And on the slide it says a second dose, but this could mean a third dose, a fourth dose. It's every 3 minutes as necessary. Then
if you're in Stoughton at that point, if you have called 911, they're going to be there. Like I feel like I can confidently say they will be there by then. Yeah.
Yeah. And then, the other roles are more pertinent to a program. So if you were in a place where there were other pedestrians, things like that, other civilians, it's good to get them kind of cleared out of the way. Make sure everyone's okay. It can be traumatic to witness these things. And so regardless of programmer on the street, I'm the type of person who's going to want to make sure everyone's all right and is okay with what's going on. And then ideally at the back end of these situations, if everyone involved can take some time just to check in with one another, talk about it, process it, and also identify what went right. what could have went better, just in case we encounter it again. And so after we've contacted 911, we, administered the Narcan, we want to pass off any pertinent information to the first responders. If we can, depending on where you are, if you're inside a building, if you can have someone outside to meet those first responders, some buildings are like a labyrinth and they might not find their way. So to have someone be able to meet them outside, walk them directly to the person while passing off any pertinent information, it's only going to benefit the person that needs the help in that moment of time, as well as the first responders to delivering that help. Next slide, please. And that brings us to questions. Do you guys have any questions that have gone unanswered?
Where's my cheat sheet?
I'm trying to think. I feel like you covered a lot of ground, and we had a lot of really good discussions in the middle, so I don't think I have other questions. Can we take one of those Narcan things? I don't know that it matters to take it out of the package and show people.
Yeah, absolutely. So as you can see, it's really convenient. It's like designed to fit in your hand. There's a red plunger down here, and it just goes in the nose. You push the plunger, it's one and done. You don't have to go alternate nostrils or anything like that. It's just push it into the nostril, push the plunger, and it's done. And that's it. It's not reusable. That one's thrown away. If 3 minutes later you open up the other one. It's very user-friendly, very easy. It's just important before you get it in the nose, make sure you don't put your finger on the plunger. It can be a little sensitive.
Oh.
So you wouldn't want to push it off into the air when
Right.
the person needs to have it administered.
Right.
And yeah, it's that simple. It used to be a lot more complicated and you had to assemble things. And
That's right.
since they came out with this 4 milligram dosing in this system, it's been a lot more effective and a lot easier in those highly excited moments. So
Yeah, it's nice to not have to put something together. I remember there was like a glass tube and a thing, and it was like 3 parts and caps and all kinds of crazy things.
Yeah, and if you ever encounter a situation where the person's nasal cavity has been compromised, one thing I learned through attendant training similar to this is Narcan is just as effective rectally. So if you can't get it into the nasal mucous membranes, the rectal mucous membranes work just as well. And that's actually the route of administration for Narcan that they recommend, say a dog happened upon some opiates. They recommend it goes rectally for animals. And it's just as effective, just as quick, everything. Just a kind of a fun fact, I guess.
Right.
But the preference is nasally.
Right, right. That actually, when you mentioned dogs and Narcan, and that it made me think about safe disposal, right? And when people have had medications for opiates, right? Like maybe they've had dental surgery, or somebody has the transdermal patches because they're maybe, it's sort of. They've had like a long chronic situation, maybe they're in hospice, and that periodically sometimes animals can get into these things. We sometimes we talk about inadvertently, other people like going into the medicine cabinet, but it could be that like something spilled on the floor. So can we talk about safe disposal for a minute and just sort of people's options for safely getting rid of excess opioids so they don't get, things that maybe started out as prescription, they don't end up out in the world?
Yeah, and I think that's an important conversation, because if we have things like this residing in our medicine cabinet, I have 2 young children at home, I would not want them to get their hands on them. So I know periodically we'll see safe disposals offered.
We do drug take back days here in Stoughton once a year. During Hazardous Waste Day, we offer that. The police department has a kiosk. I think one of our pharmacies has a kiosk
Walgreens.
as well. Walgreens. And actually on the FDA website, there are really good directions about how to safely dispose of medication in like coffee grounds or in cat litter if you have a cat in the house. so that we can make sure people can get that stuff out, and that the transdermal patches I've read are sometimes better to just flush. Like, we don't usually recommend flushing things down the toilet, but that's a situation where that's what I've read. But check the FDA website for better information, more current information. But there are ways people, you don't have to necessarily travel to dispose of your meds. There are safe ways to do that, but better to not hang on to that stuff.
Absolutely.
Yeah, accidents can happen.
Maybe we should do a mobile drug dispensary where to senior citizen houses and.
Oh, a mobile take back. We actually have done that in the past with some of the housing complexes and for seniors and folks who have physical disabilities and can't get out to dispose of things. In conjunction with our Visiting Nurses Association, pharmacist, police department. It takes a little coordination, but it's something you can do. It's possible. Yeah.
It's a great idea.
Yeah. Other questions that we can think of? I think we covered a lot of ground.
I don't know, a question opposed to a comment.
Okay.
I think this is great for our teens to have this conversation because we don't know when they're over friends' houses, significant others. Mm-hmm. As parents, we do our diligence and investigate. Okay, where are you going? Who are you with?
Right.
What's the number? And those kids could be awfully sneaky, or at least I know I was. So maybe have an open platform with kids of, if you see something, do something.
Right.
Educate, our young kids. At teenagers, they're going out more.
Right.
So maybe this is a good conversation of just, it's worse hearing the, oh, Mom, do we have to have this conversation? Because you never know what position they might be in. And
right. Yep. Well, and we often will teach kids first aid and CPR, and I feel like this is a tool in that same tool bag. I mean, we're talking about it in the context of also like rescue breathing and compressions, chest compressions, and and people who have allergies carry EpiPens, and and it's important for people to know how to use those too. So I think, I think it's important, and I think when we think about teenagers and the adolescent brain and things that happen, right, and kids, it's really important to be clear with teenagers about expectations, and we talk a lot about that in our prevention work and really trying to delay first use of substances and all of those pieces, but also to say, like, in an emergency situation, if you're in trouble, somebody else is in trouble, there's a medical emergency, somebody's at risk of getting really hurt, like, those are times where the most important thing is to get help, or, to call a trusted adult, to bring somebody in, to call 911. Like, the first thing we want to do is help people, because if somebody gets significantly injured or dies in a situation, that's really different than, like, I'm angry at you because you did this thing. Like, we don't want to compound it
Right.
by putting somebody's life at risk. And so I think, being clear with our kids around, like, listen, like, these are my expectations, and I'm always here to help you, and I will always come and help. We might be having a conversation later, but, like, that we want everybody to be safe, and that's the most important thing, because, like we were saying earlier, we can't help people if they aren't around anymore. So we gotta, have those hard conversations.
Yeah, and I think the more we have those hard conversations, the less difficult
That's
they
right.
become to have,
Right. Yeah.
while also reducing that stigma around the topic throughout the community, because it gets normalized within our own homes.
Right. Absolutely.
Yeah.
Right. Awesome. Well, I want to say thank you to both of you for being here. I want to thank Christine for being the voice of our community audience, which we appreciate, and being able to, like, for us to have a little bit of a dialogue. And I really want to thank you, Dan, for bringing the slides and the Narcan and providing this. I do want to let folks at home know that we are recording this because we want to make this available to everybody, and to have this information out there. And we are actually tonight, so I know this won't air until afterwards, but We are doing this presentation live at the Stoughton Public Library, and we are doing a Zoom version of this presentation as well. So we really will have a live studio audience in those settings. But I wanted people to know that this is also happening in the community. But we really felt like having this resource for people to access whenever they wanted it or needed it or had time was important. And so thank you again to the two of you for coming in here and playing along and making that possible for people in Stoughton, and in the spirit of helping each other and a healthier community. And I really appreciate it.
Thank you.
Great.
Excellent. Thank you so much for having me.